Hi, everybody. I'm really, really excited to be here with you. Um, International Week of the Midwife. As Sue said, we've had it fell on a bank holiday Monday, so we've all kind of didn't get the chance to celebrate it till the Tuesday. Today, it will be great for us to celebrate whilst we're on here. So I will be sharing with you. Next slide, please, Angelo. Thank you. I will be discussing just give you a bit of an idea of how to go about progressing your career in midwifery. One of the speakers that just spoke on the video that we've just watched said midwifery is a part of them, and actually I think a lot of us would agree with that. Midwifery is a part of who we are. It's just what we do, and for me personally it was really important that I moved from midwifery being a profession to midwifery being who I am, a career that I want to progress in, and I'll share that with you this evening. Next slide, please. Thank you. So I will be looking at becoming a consultant midwife, choices, directions, and routes. However, I do have a framework to share with you, and this framework is very much is transferable. So you don't actually have to aspire to be a consultant midwife to use it. It could be anything really within the midwifery remit or maternal and neonatal remit, or even those of you that have joined and are friends and families of midwives. It's something that you can use in your own career or industry. Next slide, please. I divided my talk into 3 sections. The first part will be looking at background and context, so a little bit of foundation of knowledge, so the role of the consultant midwife, and the pillars of practice, very, very briefly. And please, can I signpost you to the reference or bibliography links that Sue will be sharing, because that will give you a little more explanation of what the role of the consultant midwife is. Honestly, I would not do it any justice. There really isn't enough time. So I'll give you an introduction to what it looks like, and then I'll give you a bit of homework. Then part of the presentation, we'll look at a case study. So using some reports from my colleague consultant midwives, hi everybody, from the RCM network, who are very, very supportive. And, I had a lot of career pathways, which hopefully I'll be able to share later on and at some point. But for this presentation, I've got 3 examples of what career progression looks like, or how consultant midwives got to be where they are today. And then I will share my career journey with you as well. And then the latter part of the presentation is planning for success. So you do have to plan for your progression. It's not something that just comes to you. It's all a myth. Nothing comes to you if you don't work towards it. So choosing a career path. So I will look at some strategies for growth. I will introduce the IDA framework, which is IDA framework, and it stands for something, which we'll go into in a little while, and some key tips for you to take away. Next slide, please. So sorry, the next slide is actually, Angelo, I do apologize. This will be a video from the RCM Consultant Midwives Network, wishing you all a happy International Day of the Midwife. So I hope you enjoy this video. Thank you.
We are RCM affiliated consultant midwives from the United Kingdom.
We would like to wish midwives around the world a happy International Day of the Midwife.
Who are we, and how do we respond to humanitarian crises?
We are advocates.
We are educators.
We are counsellors. We are community health promoters.
Consultant midwives play a crucial role in humanitarian crisis.
We adapt to provide safe and effective care no matter the circumstances.
We are consultant midwives. We are here, ready to respond.
We are voices that communities trust.
For this year's International Day of the Midwife, we have one request.
We believe it's time
to take action.
It is time
to remove the barriers that hold midwives back,
so that we can apply the full scope of our skills to serve women, birthing people and children to the best of our abilities.
It is time to give midwives the tools they need to provide safer, more equitable and more personalised care.
We are here, ready to respond.
We are here, ready to respond.
Happy International Day of the Midwife.
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 Thank you for all you do in times of crisis.
We are ready. We are ready to respond. We are ready to lead. We are ready to support midwives all around the United Kingdom to provide care no matter the circumstances. We believe that supporting midwives means investing in community health and resilience. We are consultant midwives. We are critical in every crisis.
Thank you, everybody. So that was our video from the RCM network. It's really lovely to see a lot of my colleagues in one video. So now I'll share with you how I became a consultant midwife, but I will go back to the little girl and where I'm from and what shaped me really, because we all have a background. So actually, before I go any further, for inclusion reasons, for those that are also listening by audio, I am a Black woman. I've got braids in my hair and I'm wearing a color block shirt made of black, red and white, and I have begun my presentation and I'll let you know when I'm done talking. So I'll continue. So the journey before midwifery. So I was born in Ghana, a country in West Africa, and my dad was a soldier, so I lived in the barracks, very, very regimented. Everything is very scheduled, which I believe has really shaped who I am, because I've always planned and I think I'm quite organized. I was raised by my grandmother, so hey to the grandmothers, they do a good job, and it was brilliant because she was a single parent, but she really did her best to make sure that we got good education and that we had a career. So I lived in North London in Tottenham, so that's where I'm originally from. I went to a secondary school called Glazemore Community School. At the time, this is one of the pockets of deprivation in London. So obviously there were challenges. Even the school wasn't as great as it could have been, but now they're doing really, really well, which is really good to know. And went to college, did my A levels, went to university, did my degree in midwifery, and I think I became a midwife at the age of 21. So I was quite a young midwife, and I think it really helped me. Just kind of growing up, because in midwifery, and I think a lot of you would agree, you really do come in contact with challenges and you're actually dealing with real life. So where you'd have friends just the same age as you who are coming to you and talking about what they went to drink last night and they're hangover, and you're thinking, no, I could never, because I've got work the next day or I've got placement the next day. So as a young girl, it was a little bit challenging, but I think looking back, it really did shape who I am today, because what it does is it grows you up. You have no choice. You have to mature in as a midwife, because your people are relying on you. You're dealing with families. These are real issues that you deal with. Your assisting birth. You have to be mature and you have to be responsible. So I think I became responsible at a very young age because of the career that I chose, and I don't regret it at all. Next slide, please. Thank you. So we'll go into the role of the consultant midwife very, very briefly. And those of you who are aspiring to be consultant midwives, what I would also advise is that you speak to your local consultant midwives to get a little bit more understanding of what they do, because the consultant midwife role, it does vary in remits. and areas of expertise. However, it all has to fulfill the pillars of practice. So the consultant midwives have been shown to be the key in increasing choice and personalization in maternity services. And you might hear the pillars of practice, the pillars of practice, the pillars of practice. And that's basically what I've got here in red. So we've got expert clinical practice, which is direct clinical care. We have leadership and consultancy, so that's professional advisory and policy. The consultant midwives do contribute to policy documents and part of discussions which lead to those as well. Research and evaluation. Which is where I'm more kind of leaning towards in my role. So that's evidence generation and audit, and then you have education and development, which I do a lot of as well, teaching and practice innovation. Strategic service development is something that has been added onto the pillars. It used to be 4, but now it's 5. Consultant midwives do that anyways. It's just been acknowledged. So yes, strategy and governance is also part of the work that we do. Next slide, please. So becoming a consultant midwife, if you were wondering, actually, how do you become a consultant midwife? There really isn't a blueprint out there of the career path that you should take to become a consultant midwife. And actually, you find that a lot of consultant midwives have just worked through and through hard work and recognition, and also through applying for jobs, they've kind of found themselves where they are. And lots of my colleagues are very much enjoying their role. However, there are similarities in a lot of the things that we've all done to get us to where we are today. So if I've got 3 consultant midwives here, and this is their background, really. This is what they've done. So I've got consultant midwife 1, started as a rotation midwife, then elective cesarean birth lead, then band 7 coordinator, community midwife. You can take a screenshot of this if it would help, or you can go back and have a watch later on if it would help. Birth center midwife, birth center lead, band 7, bleep holder, band 7, inpatient matron, then interim deputy head of midwifery, and then eventually she became a consultant midwife. So you can see the career path there. And then the middle one, consultant midwife 2, started off as a band 6 rotational midwife, then a caseload midwife, then a volunteer for humanitarian as a humanitarian midwife, and then patient experience lead, then labor ward coordinator, and then she was an associate midwifery manager. Then she became a humanitarian midwife in Haiti, then fetal monitoring specialist midwife, inpatient matron, lead midwife, consultant midwife. So you can see the first 2 really, really, there's quite a lot of experience there. You do have to work your way through. You do have to gain the experience, and you do have to gain the knowledge. And then you've got consultant midwife 3 here. Started off as a band 5 midwife, then a band 6 hybrid midwife, band 6 caseload midwife, band 7 caseload midwife, band 7 home birth lead, then band 8B consultant midwife, and then she then became a band 8C consultant midwife after completing her master's. And having a conversation with her, she said that I wish that there had been advanced practitioner roles or trainee consultant midwife post for her back then, to kind of support the job that she did. But she went through it, and she is where she is today with a lot of experience. The career path varies. The banding typically falls between band 8B and 8C, and most consultant midwives have master's degree, and a few consultant midwives have PhDs they've already completed, and some of us are on the journey. So you can see that it is quite a healthy CV, if you would appreciate that consultant midwives do have a lot of experience, clinical experience. They have knowledge, and they also have a lot of academia behind them as well. Next slide, please. So this is my journey. This is how I became a consultant midwife. So I've kind of linked because I've always been an academic. I've always worked and studied. Because for me, I'm the kind of person that just want to understand everything and anything. I am quite I'm quite curious, and I always ask why. And I think my why always gets me to explore, and that's why I'm a researcher. I love research because it gets me to think, and it gets me to question, and it gets me to investigate. So I've always loved, I don't know, I just love studying. I think some of us do. So I've always done that. So I started my training in 2006 actually. I qualified in 2009. So I was a newly qualified midwife in 2009. And I remember this particular matron at the time when I qualified. I think 3 months into qualifying, she said to me, "Patience, I'm going to take you on a management course." And I said, "Why? I've only just started." And she said, "Well, I can see that you're very active, and it is something that you'd be good at." So I said, "Okay, fair enough." So that was a leadership course that I did in 2011 there that you can see at the bottom. Um, so just to go back, I have done in terms of practical clinical practice. Sorry, I was a perinatal mental health midwife. I had a lot of interest in female genital mutilation, which kind of carried on from me being an undergrad because I did it for my dissertation and I explored the subject area. So I carried it on. And then I moved from the unit that I trained in and worked in for 5 years into another hospital, which was a tertiary unit in London. And I was really excited about that because there was lots and lots of cases that I hadn't been exposed to before. And like I said, I'm always wanting to learn. So for me, it was a challenge, and I do love a challenge. So I thought, oh, this is a high risk unit. Let me go there and see what I can learn from there. So moving to that hospital in 2015 exposed me to a role in perinatal mental health, which I really, really enjoyed doing. So I did that role for about a year and a half, and then I became a postnatal ward manager. And I think this is where things changed for me because I became a manager, line manager. I managed about 40 members of staff on a 39-bedded postnatal ward with a transitional care unit, very, very busy tertiary unit in London. And that really tested my personality, and I learned a lot from that role. And I think that role, funny enough, when I started, and the matron that that appointed me, I still speak to her now. We always laugh about this. I started the role, and she said to me, "Patience, I have a project for you." I said, "Well, what do you mean you have a project for me? I'm a ward manager. I've come to do the rosters and sickness management, and to learn all this, and the day to day, the troubleshooting. This is what I'm here for." And she said, "No, I've got two managers that are already doing that. I want you to lead quality improvement." And I thought, I don't know what that is. What do I do with that? I'm a midwife. I'm not a project manager. What's this? Anyway, so she then said to me, and I remember this really well. I started on the 3rd of March, I believe it was, and she said to me, "You've got 4 weeks to turn the project around." 4 weeks. I had no experience. So I thought, okay, fine. I'm going to have to just start this from scratch. So I started doing some research. How do you manage a project? And I mean, we had a QI team within the hospital that I was working in, but did I contact them? No, I didn't, because I didn't know they existed. So I went to another hospital who had because she wanted me to lead the discharge pathway. They had a discharge pathway, and I basically went there and shadowed and learned how to go about it. And then I came back and I showed her my plan, and cut story short, I executed the project. And I really, really enjoyed it. It was really challenging. There were lessons learned. Going back, there's a lot of things I would have done differently in terms of engaging staff and carrying them along. Back then, I didn't know what that meant, so I kind of went about it a different way, which kind of resulted in a lot of resistance. But in the end, it all worked out. But I really enjoyed that, and I found my ikigai, and I'll tell you about ikigai in a minute. I found my ikigai in that role. I thought, this is me. So I went and studied project management. If you can see that in one of the clouds there, I went and studied project management because I thought, gosh, this is me. I love managing projects. This is me, So I did that. And then after that, shortly after I qualified, I became a transformation lead for a local authority on the Healthy Child program, which also very much linked into maternity transformation program. So I was just set for that. I was really excited in that role. I learned how to present. I learned how to draft presentations. I learned how to have meetings on a higher level and writing reports. And I was exposed to quite a lot of skills. And then following that, well, actually, at the same time, I started my MBA because for me, I wanted to understand the business side of the NHS. I mean, why is it that we're told to manage and, or budget? Why are we told that we can't book a lot of branches? Why are we told that, we can't order this sometimes, or we have to make sure that we don't over order this? And I thought, there's something going on that I don't understand. It's not connecting, and I want to know. So I studied MBA. And it was the best thing I ever did because I didn't have a master's degree at that point. So it was really worth my money. I loved MBA, and it really did expose me to a lot of the things that I know today. Following the MBA, I then became, there was an opportunity to work as a trainee consultant midwife, so to be trained into a consultant midwife role, which was brilliant because I had a fantastic consultant midwife who trained me, called Heidi. Brilliant consultant midwife. She's still practicing, and she trained me, and I captured it really quickly, and I knew this was me because when I looked at the pillars, I'm very active, but I love clinical practice. I love research. I love QI. I love leadership. I just enjoy all the pillars, and I thought, this is me. So that was really exciting and really interesting element of my career pathway. And then I got the opportunity to become an associate professor and consultant midwife, and also enroll in a PhD journey. And I thought, this is brilliant for me. So that's where I am at the moment. I have done things in between. I've done a project in Malaysia for the United Nations, which was sponsored by the British Council. I kind of take opportunities as they come because I know that these things sometimes don't come again. And I will tell you more about that and how to actually grab the chance to do things. When things come up, you need to make quick decisions. I will talk you through that actually, because my that's what my framework is about. Next slide, please. So when did it all start? These are just some pictures from Malaysia for you to have a look at whilst I talk through this. So professional growth, the why, the when, and the how. It all started in 2019, actually, when I decided that I am going to work on my success. I'm going to take ownership. I'm going to take control. And I had to shift from surviving in midwifery because, let's face it, I am a midwife and I love what I do, but it is challenging. It is very challenging, and sometimes you go and you think, I can't do this anymore. How long am I going to do this? I'm running out of steam. I'm always tired. These hours are long, and then you finish and you come home and you think, I can't even rest. I can't sleep. I have to go back tomorrow, and you give your 110%, and it's just a cycle. So it got to a point, and I will be very honest with you, it did get to a point where I didn't want to do midwifery anymore. I wanted to be a social worker, and I actually got accepted until my manager had to give me reference. The same manager who got me to do the project when I started my job, and she was just delaying this reference because she didn't want to give it to me. She just didn't want me to leave. And in the end, another opportunity came, and she said, well, there you go. This was a sign. I said, no, it wasn't. You just did not want me to go. But yes, I was thinking of becoming a social worker, but thankfully it didn't get to that. But what I'm trying to say to you is that I was so frustrated, and this is because of the challenges. As we've all gone through it. I've gone through it. I don't want you to have a look at my career path and think it's been smooth. It hasn't. I've had those moments as well, but I had to then kind of recalibrate my mind and go from survive in midwifery to thrive in midwifery. So that's when I applied for a job as a matron, and sometimes you feel like this is mine. You have this entitlement. This is my job. Everybody knows that I'll be good at this. Unfortunately, I did not prepare for the interview. I had to take ownership. I did not prepare for the interview, and it was just dreadful. And actually, looking back, of course, they should not have given me the job, but at the time it was difficult to understand. But what came out of that really was a reflection and self-awareness. So I had this a panel member who was really, really great. She came back and she gave me feedback, and I wrote it all down. And that's when I started planning for success. Next slide, please. So strategies for growth. So for me, I have learned, like I said before, that embracing challenges can lead to greater professional fulfillment and opportunities for growth. And that I really want to get this across. There is no such thing as it will come to me. You really have to work through this. Next slide, please. I'll quickly go through the IDA framework, and please do go back and have a read, because this is really what helped me with my career progression. And for me, the aim is to empower midwives to navigate their career paths with clarity and confidence. Next slide, please. So IDA stands for intentions, decisions, and actions. Next slide, please. You have to, I think sometimes we kind of misunderstand when it comes to career progression. We do have this entitlement. I'm a midwife and I've been qualified for X amount of years, and therefore, of course, I should be promoted. This is what we think sometimes. No, it doesn't happen that way. You have to intentionally plan your success. You have to find your ikigai. Like I said, I found my ikigai. I realized that project management was me, quality improvement. Anything to do with projects you put me in charge of, I am confident that I can execute. So you have to actually sit down one day and say, who am I and what am I really good at in midwifery? Because we all are, we're all good at something. So ikigai, just to give you a bit of background, is a Japanese concept of discovering your purpose through exploring the intersection of what you love, what you are good at, what the world needs, and what you can be paid for. Because yes, we kind of try to avoid payment when we apply for jobs, but actually it is part of it and is an incentive. So you need to actually decide what you're good at, what you want to get paid for, and leverage on it. There's no need doing something that I'm doing because you admire me. Admiration doesn't have to be aspiration. You can admire somebody, but you don't have to aspire to be who they are. And I really don't want you to look at me to then think, I want to be a consultant midwife like Patience, because it might not be something that you want to do. So it's best you sit down and decide what you're good at and have a plan on how you're going to use that to grow your career. Next slide, please. Decisions. So this is really important, and I think we waste a lot of time. So you identify what you're good at. There are two types of decisions, by the way. I'll talk about that first, actually. So type 1 decisions are those difficult decisions that you have to make. You have to decide whether this job is closer to home or not. How long is it going to take me to go? Is it going to be costly? Is it going to impact my family? Am I going to need childcare? Do I have childcare? You have to weigh those out. Those are difficult decisions. You don't make them easily, regarding the job that you're going to apply. Type 2 decisions are decisions that are easy to make decisions. The job is there for you. You can do it, but then you're sitting on it and you're going, well, I'm not sure, and you're making excuses. You're not applying for the job. But guess what? There is somebody else out there that is applying for that job, and you need to remember that these jobs are not waiting for you. Every job that you apply for is an opportunity to learn. Don't worry too much about whether you're going to get the job or not. It's about, okay, what can I learn from this process? Even the interview, if you don't get interviewed, even writing your personal statement is something to learn from. So let quick decisions remain quick decisions, and do not overthink, and don't get left behind, because actually the world will be moving. Next one, please. Actions. So this is based on the Let Me Theory by Mel Robbins from her book Let Them. So the Let Me Theory basically tells you to take control. You need to take control of your own life. You need to take control, take responsibility of your own career pathway. Nobody cares more about your career progression than you. Don't blame anybody for what you don't become. You need to make sure that it's your job to make sure that you get to where you want to be. And then you can approach people to help you, to support you, so you can shadow them, to mentor you, to coach you. But you have to make that step. You have to take that action. Next slide, please. So that is IDA framework. Sorry, I had to rush through it because I'm very mindful of the time. But you can go back and have a look on the demand and stop and start and take notes if you wish to. So I is for intention. So intentionally plan your success. Find your ikigai. Decisions, be aware of the type of career decisions you need to make. Is it a type 1 decision? Is it a type 2 decision? And you would remember me when you think about this. The patient said you need to make it quick. Yes, it does. You've got to be quick. We live in a world that is moving fast. And I feel like sometimes as midwives, we're in our own world and we forget that there's a world out there. There are other industries out there that are moving really fast, and you kind of need to catch up. Actions, your career growth is your responsibility. Act on it. Okay, so IDA, IDA, intentions, decisions, actions. Next slide, please. Key tips. This is just a long list of things that you could possibly do. Okay, and I want you to go home after this show and I want you to sit down and use IDA to plan your career, because that's why you're here today. I want you to be intentional. I want you to decide, when you've become intentional, what are the things that you need to do? And then you need to take action. You need to identify mentors. You need to network. I mean, gosh, I'm known for networking. I love networking. You just meet so many amazing people. Shadowing. I've shadowed a lot of people in my lifetime, and I'm still shadowing to know the roles that they're doing and what I can get from it. CV updates. Do you even have a CV? Sometimes, as midwife, we feel like we don't need CVs. Yes, you do need a CV. You need to write one if you don't have one. And if you've got one, you need to update it. It always needs to be updated. So when that job comes, remember, you need to be quick. Interview preparations. When was the last time you had an interview? Some people haven't had interviews from when they were band 5s, and yes, you have progressed and you have become a band 7, but it's probably in the same trust, because a lot of us remain in the same trust as well, which I would advise that you don't do if you can help it. Try and explore, go elsewhere. You need to move around. You need to expose yourself to what's new. The challenge part of it is really important. So yes, interview prep is important. Interview practice, podcasts. I love podcasts. I mean, this is my favorite podcast, by the way. I do listen to many podcasts about career progression, and unfortunately sometimes we don't have industry specific podcasts for maternity, so that's why I'm here today. It would be great to actually have one of those, but if you listen to these podcasts, you can translate that into your own field. Exposure, you can do some volunteer work, practice journaling. So you need to write things down that you've done, because these are very easy to forget. Searching for jobs. You could jobs that you would like to do. Look at the JD. What does it say? What does their personal specification ask for? Do you have those? Tick them. If you don't, you need to work on them. You have to be active. Academia. When was the last time you studied? Is there something that you need to do to actually give yourself a bit of credibility? To broaden your knowledge. Cover letters, have you written one before? If not, you need to learn how to do one. And supporting statement, when was the last time you did this? You need to have a look at all these things. It's a long list, but honestly, it's not as long as I would have liked it to be. So yes, I hope you can go and have a look and work on it. Next slide, please. So just to conclude, seek mentorship and continuous learning opportunities, build a solid network, and stay informed about industry changes. Yes, midwifery does change, and we're all very much aware the world is changing, our women are changing, our birthing people are changing, and so do we. We need to catch up to them, so we'll be able to speak to them in the language that they understand, to enhance your career prospects and satisfaction. I think this is the last slide. Thank you so much, everybody.